So I put my non-sterile gloves on. My arm is dry. So now I'm going to go back and put my tourniquet back on. Again, you make the crisscross, do the tuck away from the patient. I can check my pulse. We're good to go. I'm going to pick up my catheter. You want to have the tab side up, and you want to just remove it gently. Okay, so I'm going to show you what it's going to look like when it goes in the arm to start with. Make sure that my glove is on snug so it doesn't contaminate the IV. But I want the tab up. You'll notice that my thumb and my middle finger are on the grooved sides on the side. And I'm going to take and I'm going to be pulling back with my forefinger as I do my insertion. I'm going to be inserting, if this is the hand, it would be 10 to 20. It's 15 to 30 for the actual forearm where we're going today. So what's going to happen is I'm going to get that angle. I'm going to just go in pulling back as I go in. Once I get my flash, I'm going to lower it a little bit and advance it further. Then I'm going to take my finger and I am going to just move it from pulling backwards to pushing forwards. And you can see that that advances the catheter, but the needle stays in place. So what that looks like on the arm. I pick it up. I can hold my arm two ways. You can either take and pull back on your thumb. What we're trying to do is secure the vein. Or you can take and put your fingers on either side and pull the skin taut. But again, I can't touch the site of where I'm going to go. So I'm going to stand here. I'm anchored my fingers on the patient's arm. Being careful not to go across my thumb. I go in. Remember, we're at that 15 to 30. I feel the glide. I can see my flash, so I drop it a little and go a little forward. Then I take my finger and I switch to pushing forward instead of pulling back. And I'm going to put the catheter up to the skin, but not actually touching. You leave a little bit of room so that it doesn't cause irritation at the skin. The next move is to hold that finger still tight, but move my thumb and my middle finger back until you hear a click. Once you hear the click, you're going to undo your tourniquet. So it's click, flick. At this point, I can stabilize my catheter, and I'm going to pull off the cover. I'm going to be careful not to touch anything on the sticky. I'm actually just staying on the frame itself. And you're going to set it down with about 1/8 of an inch for the roller clamp of the extension set that we're going to be putting on. And you're going to make sure that you start at the actual catheter, and then we're going to smooth it out from that point because we want to make sure that we get that really nice and snug across the catheter. Then I'm going to continue to support the Jelco, and I'm going to pull around the frame, again smoothing as we go. Be careful when you get to the part that you wrote on because there's a split to make it easier to tear off when we get to that point, and we have it on. So now we're to the point where we're going to put our extension set on. So we're going to put a little bit of that 2x2 underneath because it should drip a little bit while we hook it in. So this is kind of a tricky part. You're going to take the cap off, and again, we cannot touch it. So I like to put it between my middle finger and my first finger. I'm going to take my left hand, I'm going to occlude at the end while I support my actual catheter that's in the patient. The Jelcos are wonderful because if you turn them about 1/4 of an inch, it actually will disengage and allow you to be able to push in your extension set. Now, notice that I did not throw my catheter down yet. If I would have hit any point and contaminated the tip of this, I could do the reverse, stick it back in, and be able to alcohol it off and do it again. But since I didn't contaminate, I can now put that back into the plastic, make sure it's roller clamped on tight, and I am going to kind of clean that off. Get rid of the bloody one into my garbage again. So now I'm going to unclamp my extension set. I'm going to pull back and make sure I get a little bit of blood, but you don't want to pull it all the way in because otherwise you don't have clear saline. And I am then going to push. Once I've put in a couple of mLs, I'm actually going to use positive pressure, and I'm going to clamp the extension set while I'm still pushing. This keeps the blood from being in the tip of the catheter and only saline. So then I can unscrew this, and we're ready to tape. So like to take the first part, piece of tape, you're going to go right up onto the hard part of the extension set without going over the roller clamp. You're going to go all the way around so that your thumbs meet, so it gives a nice secure hold, and push it down onto my patient. Next, I'm going to take another small piece, and I'm going to put this up away from the patient's hand. So you can go on either side. What you want to be careful of is you want to make sure that wherever you tape it, that you can still be able to pick it up to be able to do IV push medications without actually having to undo the rest of the tape. I like to kind of overlap it as well so that you have less on the patient's skin. Last, we're going to come back to our sticker. We're going to make sure that we do not place it somewhere that we would occlude being able to see when we have to assess it. So you usually want to go up and down along the edge of it and smooth it out. At this point, I'm going to throw away my needle in the sharps container. Make sure it goes down. I'm going to take anything else that's bloody, which at this point is just my gauze pad, and I'm going to palm it, and I'm going to take my gloves off and double glove it, throw it away, and the rest of my supplies can just go in the general garbage.